Well, welcome to NUR203 Pediatric Nursing. I am Professor Bogart, and I've been with Fortis for quite a few years now, since 2017. I was having communication with some of you who came in a little earlier. I first started teaching pharmacology and pediatrics, so I'm really good at dosage calc. Anybody who wants to learn it simplistically, that is not ratio proportion. I don't understand that. But the way I can teach you is only 3 formulas. The desire, have quantity, then it's the drops per minute and mLs per hour. Everything works into those, and I'll even show you how to do it. So week 1, there's a lot of stuff going on. Many of you have already heard the orientation PowerPoint. I'm going to be doing a week 1 PowerPoint, and I do also have a Kahoots that we'll try to get through. Now I have a question. I can go straight through the whole class and get you out about 20, 25 minutes early, or we could take a break in the middle. What would you all like to do?
No, early.
Leave early.
Leave early.
Yeah, I figured that's what it would be, but I'll let you know. Hopefully my voice will keep up with me today. Let me tell you what goes on with my voice. I'm not sick. I have this unbelievable illness called rheumatoid arthritis. And there's a joint in your voice box, and it's inflamed, and it causes me a raspy voice. I'm not sick. It's just part of the condition. And it be good, and then it will be raspy. So it is my voice. Now, let's say my voice is to that point where you're having difficulty understanding. On my YouTube channel, I have got every week 1 from the beginning of time. You could go back and listen to last quarter's video if you want to or need to. Hopefully I'll be clear enough, and when I'm not, stop me. Say, I don't understand. What did you say? And I will sit and try to explain it to you, okay? At any time, if I'm lecturing and I'm going too quick, because I tend to do that, and you're not getting me, please just stop and say, Professor, I have a question. I'm not offended. I don't get upset. And I want your questions. Because if you have a question, I'm sure somebody else does too. Ashley, could you have one of those cameras turned on? Severe. Can I have a camera turned on? Ashley? While we're waiting for her, everybody put your name and your campus in the chat box for me. That'll help me keep track of you. Ashley, you need to be on camera or I have to remove you. And I don't want to do that. Does anybody know Ashley? Ashley, could you talk to me and turn your mute off?
And can you hear me now?
Oh, I can hear you now. I don't have a camera visual of you.
Okay, it's delaying. It said something else was using my camera, so it's trying to turn on again, I think.
Okay, I appreciate you answering me. That's why I'm waiting. I'm patient. I know it's a lot of technical and internet things that go on. Plus, it's trying to figure out how to use Zoom.
I'm sorry.
You're still
yes,
up there.
delayed. I changed the networks, but
yeah, it's her internet. You can hear it. Ashley, when you can, please just get on camera, okay? I'm just gonna continue with class at this point. Any questions before we start about anything? About looking at the syllabus? Ashley, this will also be recorded too with that internet going the way it is right now. There she is. Hello, Ashley. Welcome.
There we go. It caught up to us now.
I know your internet's not that great. So.
Hey, sorry about that.
It's okay. We waited for you because that's what we do as a team. And nursing is a team, and we wait for everybody. So here we go.
Thank you.
Now, a lot of you do have other classes. Most of you are in community, correct? So you've already been through this PowerPoint before, correct? Mine's a different color. I don't like the green color, so I changed mine. Give it some new pizzazz, as I call it. So this is basically rules of online nursing and what to expect from me and what I expect from you. And I want you to know I'm consistent with everybody. There is no favorites. There's certain things I've got to draw a line on, but I also can help you through this whole course. And that way is through you communicating with me. For instance, the one thing about me, if you communicate, let me know I can't get the assignment done because I'm sick, my kid's sick, or there was an emergency in the family. Tell me before it's due, or tell me before you miss a class, and I work with you better. Okay, you can't tell me after and expect me to increase the time of an assignment. Tell me before, and I cannot maybe take that 10% off. Okay. So that's the biggest thing with me, communication. I will work with you. So whenever you have any problems, always contact me, Canvas, email. I have it on the phone, so I'm always checking emails. I'm actually pretty quick with answering. The one thing that you could do is, and I've already had one person do it, contact me on my cell phone. And that's when it's an emergent. I got something to know. I need to know it quickly. So do just take and send me a message on my cell phone. And that is posted, but let me tell you it again. It's 305-951-8055. And it is on About Instructor sheet, so you do have it there. Now, I am the lead pediatric professor. I make the Kahoots, I make the PowerPoints, I make some of the handouts, not all of them. I've got some other instructors that make some really good ones, so I use theirs also. Now, if I'm not giving you what you want or not getting you an answer quick enough, I want you to contact the dean, Darlene Brown. Now, there is her email and there is her phone number. I'm not offended. I won't be upset. We work hand in hand. If I can't give you an answer, please contact her. Okay? Because we want your needs met when you need them met. Okay? So communicating, whenever you communicate, just tell me what you want, what you need. And again, just be professional in everything you do. Now, most of you have already done your discussion question by Wednesday night. I think there's one person left. Now, this is the only week that we'll just let it go by. After that, you'll get a 10% deduction because it's not on time. But then you need two peer people that you respond to. Now, there's always questions. Do you have to wait to do those peer responses? I don't make you wait. If you're putting in your discussion question, you have it on the mind, right? You're in that mode. So go ahead, answer two of your peers at that time if you want, okay? There are some that don't do it that way, but I think for me, that makes sense. Now, we really...
Professor, I have a question.
Sure.
Yeah, I don't know if I put the Zoom link that was sent to me here, and I'm on this class, but it previously said that my teacher was Tina Ashton Hall, something like that.
Yes, it was. They changed classes.
They changed to you?
Yes.
I just want to make sure that I'm in class.
Yes. Yep, you're good. They take and put out a bunch of classes. Just to let you know what happens, Marie. They make a bunch of classes and they assume you have this many students, and then students, they're not taking peds, etc. So they decrease the amount of classes. So I ended up taking Tina's class? So yes, that's a very good question. Or maybe I should have said that. So, because I'm sure there's somebody else here. So cheating, we don't believe in. I think if you cheat, you're going to cheat yourself. Remember, when you're doing, especially it comes up to that pediatric assessment project, that plagiarism, we look at, it goes through a plagiar checker. If it is too much, I will let you know. If you do not change it and put it more into your words, I do have to report it. But I do let you know first, okay? Making sure when you're doing, your quizzes and your exams, to be on your, a behavior that is of a professional, that you're doing your own work, okay? In the end, you have to sit for an NCLEX, and that NCLEX is you alone. So if you don't put the effort and the work in now, it's not going to benefit you in the end. And I give you everything you need to be successful between my PowerPoints, my Kahoots, my HESI reviews, exam reviews. You have everything you need to be successful in this course. So again, being professional, using ethical values is what we want. And that's what being a nurse is. Now, there are some cheating sites out there, and I want you to know Fortis is very aware of them. There's a couple listed here, but there's a lot more than this. We have had students thrown out of the campus, out of the program because of using these sites. And I don't want that to happen to any one of you. Another thing about these sites, they're not all accurate information. We have found some really some information that wasn't accurate and actually could be harmful to patients if they were done the way that they were said. So do not go to them. There are some sites that are good, Simply Nursing, for one of them, that there are places to go that do give you stuff if you need extra understanding. Always remember, if you don't understand, you can always ask me. All right. I'm always available. If you need a topic you're not getting, make an appointment with me, and I'll take the least amount of time as possible with you because I know that your lives are very busy right now. So we're talking about when you don't hand homework in on time, you tell me before it happens. So it's over 7 days late. Now it's day number 8 is now late. You tell me before 7 days is up, I'm not going to take that 10% off if there's a valid reason, okay? And it can't be for, of course, every assignment, but I know that, life shows up and there are times where you're delayed, and that's all right. I mean, I understand life. I'm living it too, right? So, but normally, no problems, no communication. First 1 to 7 week, hand it in, you'll get full deduction, full credit. After that 7 days is up, that second week, it's a 10% deduction. Now, after it is 8 days late, which means that second week is done, I cannot accept it anymore unless there's some extenuating circumstance that you've told me before that time is up, okay? Attendances, you got to be on camera. That's why I made sure people were on. Make sure you're not in a car. Even if you're a passenger, you cannot be in a vehicle, all right? If you're at work, you can't be at work and be at class 2. We've had students in closets and supply rooms and all over just trying to be in class. And, I understand you have to work, but we want you to get the benefit of the class and really understanding instead of just trying to sneak. And that's not healthy for you because the information here is a lot of new stuff that you've never known. And I'm trying to make you understand it. Now, attendance, the first day, I don't take the first 15 minutes off if you're 1 minute late or 2 minutes late. I know there's confusion. Like Marie said, she thought it was another professor's class. Like other students had another Zoom number, and now they were asking me for what's this Zoom number. So the first 15 minutes, the first class, I won't take off. But from now on, you need to be here by 3 o'clock. 3:01 is 15 minutes that is deducted. Now, also make sure you stay to the end, all right? And again, I'm telling you, we'll be out early because we won't take a break and we'll go through. Now, with that being said, if you have to go to the ladies' room, the men's room, you need to get a glass of water. You know, if somebody knocks on your door, I know all this stuff happens, go ahead and quickly come back, all right? So just don't be always away from the camera, okay? Now, many of you like to hand in like all of your work all at once. Now, NCLEX questions, your discussion questions, and the pediatric assessment project are all open, which means you can do them now. I would highly suggest not to turn it in all at once because you must have 2 points of contact in your Canvas shell every week to maintain attendance along with this Zoom attendance, okay? So you could do those 3 early if you want. I would suggest doing NCLEX before exams, but I know some of you just want to get it done, and I understand that. But be careful, don't hand it in too early because 14 days of not doing that, nothing's being submitted, looks like non-attendance, and you will be dropped, and they don't have to notify you. I don't want that happening. And there is no makeup for missed attendance. But if you're sick, you have a doctor's excuse or whatever excuse that you give me some physical information why you didn't make class and you notified me before class, that attendance can be excused. And that could sometimes, and it happened last quarter, where a student was sick and she didn't show up, but she told me. And she almost was 20%, almost got a letter grade off. But because we had documentation, she didn't, and she passed beats. So it can happen. So be very careful. There's no makeup, but if you're out and there's a reason, you have physical proof, give it to me, send it to me, please. And that's what I just said, 20%, and they will decrease a letter grade. And you'll be getting notices all along. So one thing about, online nursing and doing this course online is knowing what you have to do every week. Now, I send announcements out every week, what's due. This week is discussion question. Next week, you have your first quiz, and it will be at the beginning of class. It is 10 questions. There is no math in any quiz questions. I make them up, so I know the quizzes. And the quiz questions are going to be on this week's information. Now, how do you study for it? There's how many chapters? 26, 27, 28, 29, 30, 5 chapters. Well, that's why I send a Kahoots, and we do Kahoots. It has the concepts of those areas where you might see on a quiz or you might see on an exam, okay? So those are your hints to you. One of the things about the assignments, now, people think a CJ Sims is busy work. And in the end, I'm going to show you a testament from a student who did 1145 on the HESI, I want to say her score was. And she said it was a lot because she did the CJ Sims. When she didn't understand, she looked up medicines so that she understood what she was doing in those ongoing scenarios. Because you'll see stuff like that on your NCLEX and you'll see it on your HESI. So doing the CJ Sims properly will assist you in your HESIs. She also said the NCLEX questions before exams helps. So that is your decision. As I said, they're open. I try to put some things open that you can get caught up on. CJ Sims is not one of them. There are 6 of them, and they are related to the coursework. Always check your Canvas shell. I do not place a lot of announcements, only things that are important. I think there's more announcements on the first week than I put in all of the other weeks besides. Week 1 information, week 1 recording. Week 2 information, week 2 recording. You're getting the hint. Recording is all the information. And when I give you a recording, I replace all of the handouts, your PowerPoint, to try to keep it there. So if you're going back and looking for it, you can find it easy. It's in several places, okay? When you are doing your assignments, try to get them done on time. I know sometimes on a Sunday afternoon, I'll be looking through courses and I'll see assignments aren't there. I'll be sending you a little reminder saying, hey, you didn't get this done yet. Make sure you get this in. And it's just friendly reminders. It's not, pointing my finger at you. I'm here to help you. I'm here to guide you. I want everyone here to be successful. When you're having trouble, again, talk to me. Always make sure. Make sure when you do the beginning of Canvas that you've done all of the initial work. You know that the instructor, all my information is there. It has my cell phone there, my Zoom number's there again, and it's also there on the beginning announcements. Whenever you have problems, with the internet, let's say you can't get into some sort of forum, whether it's CJ Sims or your case studies, there is a help desk ticket. And if you look at your home page, you could click it from there. So it's easy to do it. Now, let's say you're going along and, for instance, week 5 is a hard one. It's respiratory and cardiac. And cardiac can be very confusing. If you need an extra time to tutor with me, let me know. I don't set up what I call weekly tutorings. My schedule is open to be available when you're available. If I try to make a day and a time, not everybody can make it. So I open it up. When you need me, you let me know. All right, let me keep going. This is all about tutoring. Now, KGA. Now, that's key graded assignments or your objective assignments. That is your exams, quizzes, and your HESI. You have to get a 78, and then we'll add on homework. Now, if you look at the homework, CJ Sims, NCLEX, and that pediatric assessment project are your 3 big things. So looking at it, every Saunders NCLEX is 1.25%. Every CJ Sims is 1%. And that one project, that pediatric assessment project, is 3 sections, but it's 6%, which is 2% for each one. So that is usually if a student does not hand in that assessment project, they don't pass because they're going to have a homework fail. They pass KGA, but they didn't get their homework in. And it does happen every quarter. Somebody has a homework fail. I will send you reminders. Please get it in. It's this much percent. I want to make sure you pass. On week 6, I'm going to turn on homeworks, and you'll be able to see that. And then I'll turn it off week 8. Just what I just said. For exams, quizzes, come in on your phones, make sure it's charged, and then have your laptop for your exams. Again, it must be visible the whole time, and I'll be sending you messages. I even, by the time, maybe not by your quiz next week, but I'll get a whole worksheet of all your phone numbers, everything. If you're not on camera, something's not right for an exam, I'll try to say it over, turn the volume on, say, excuse me, such and such, could you turn on your camera? Or such and such, could you get on camera? But I do not like talking over silence when everybody else is in an exam. But to save somebody's neck by getting a 0, I will do it. And I'm sure if it was you, you would want me to do that too. Again, KGAs, it goes forward, not backwards, and it is 15 minutes, 10 questions, and they're simple questions. You should know these concepts by the end of this week. Quizzes can't be made up, okay? Not anymore. Again, ExamSoft, you've never, or it's been a while since you used it, I'll set up a practice exam. So please just let me know. Exams are only one attempt. And quizzes too, right? What happens if all of a sudden the power goes out, internet goes out, and you're like, or your computer turns black? I've had all of these things happen. Number one, don't worry, especially in an exam, it's not lost. What you've done will stay there. You don't have to quick upload before you X out. It's still going to be there, okay? Immediately send me a text message because that will be working, your phones usually. Say, I'm in technical problems. This happened. My computer went black, etc. And that will document a timestamp that will tell me that you're having a problem. Because every quiz, every exam has timestamps. Every time you touch a key, I know it. I can look down at every touch. So let me know and we'll reschedule it. You could pick up from where you stop from, okay? So, and usually when that happens, the student's like, so flustered, they can't go on. Yes, we can schedule it for another time. And yes, I will work with you. Now, anybody who has accommodations, you need to send me those accommodation papers by Dr. Elaine Forster. Also, you need to tell me before the exam, because when are we going to give you the exam? There's many ways we can do it. I want to do it the best way that works for you. Sometimes it's on campus. Now, if you want to do it on campus, and I know Cookeville is very notorious for that, you tell me you want it on campus, but you have to have that professor who's going to be tutoring you, monitoring you, send me an email and I will send access codes. Okay? So yes, it can be done. You have to find your person. I need to know and they need to let me know. Okay? And I do not mind doing that. And usually it's on the day of the exam, sometimes a little before or during class time. But I need to know 72 hours advance notice, okay? When you come to exams, make sure you have an ID or you have your driver's license. We'll be doing Zooms. Make sure earplugs, if you have those little non-ones, I need to see them. You can't have regular earplugs in during an exam. We'll be checking your wrists, make sure no watch is on, trying to keep you as safe from doing an exam that's showing me what your work is, okay? So any issues with exams, you let me know. Now, what if you have to miss an exam? There's been many reasons why. I need to know before the exam is going to be given, right? That's number one. And if it's due to a reason, whether it's hospitalization, whether it's just send me whatever documentation you have. And you have 1 week has to be made up before the next class. So before next Friday, if today was an exam, you would have to get it in. And we'll schedule something. I could schedule you with another professor earlier in the week if you wanted. That sometimes we can do. Or I could do it earlier, or I could do it late, whatever. I can work so many things. Again, just let me know. Again, always tell me before, not after. Because the first thing Dean Brown says, when did they tell you they couldn't take the exam? And I have to say, well, they told me after. Well, it's a minus 10% deduction. They tell me before, this and this going on, okay, no deduction. They have to take it within a week. So we will work with you. Again, communication. Isn't that what nursing is? We communicate with our patients, We communicate with our charge nurses and our physicians, right? So communication is key. Now, your first discussion question is all about reading instructions. Many of you had sent in, tell me all about you, and that was great. But there was a second part about nutrition. That is why I sent out another announcement. Make sure it's 2 parts. I'm not taking any points off for somebody who had to do it twice. That's not me. I just sent it out there because nutrition is one of the most important things in children. They're growing. How does a flower grow? You water it. How does a child grow? Nutrition. Okay, so that's why that's important. Your first NCLEX Saunders question is not under the pediatrics category. It's under growth and development. Okay, make sure when you look at the modules, follow what subjects, what areas are you to check, okay? So very important. Your quizzes will be in your modules. You click on them, you'll go through and we get there next Monday. Again, any technical problems, contact me. Now, specialty exams, most of you are going to be doing yours on campus. I've been doing the item analysis and gap analysis, whatever that is. It tells me the grades and overall mean averages of all the campuses of all the RN programs. Do you know most of them were 900 or higher? Now, how do you get 900 or higher? Every campus. Well, if you do what I tell you all quarter long, and in the end, you go back and just do the quick review of the Kahoots, a quick review of those exam study guides. And then I do on Saturday before the HESI, what I call a HESI Q&A. I do it at 2 o'clock on Saturday on week 11. I don't know the date right now. In fact, I could check it up for you right now. That would be June 22nd at 2 p.m. And what I do is I go over all the key concepts, all the key areas, try to make you think. It's about an hour and a half long. Yes, there's some from previous terms. They're already there, but I redo it again and I open anybody with questions. Students say that during the HESI, they can hear my voice guiding them along by, now that you've done all these Kahoots, you've done all the study guides and you reviewed them, you come to this HESI, it's like they can hear me during these exams. So I'm sorry if you have nightmares. And most of them say they don't have nightmares, they're very grateful. Anyway, your HESI is 20%. You know that there's remediation. I'll be posting you the times and all of that. Hopefully it'll be 900 or more, and you only have 1 hour, and that would be great. And I do get 99.99 on it on these HESIs. And I had one student who was on her skin of her teeth trying to pass last quarter. She came to me for exam 3. We had a big review. She even came on exam 2. And on the HESI, we got together. She was a 76 going into the HESI. She got a 99.99. So it can be done. Don't think, no, I'm not that student. It can be you, okay? IDs are always there. Again, any problems, let me know. I can help you. The syllabus is there, and that is your guideline. I've put in all the dates, all the times, everything's in your Canvas shell waiting for you. I keep you organized by that announcement, so just follow the announcement every week. I mean, I love having a calendar I can write on. Most of you are in the phone, everything's dialed in, or on your computers. Whatever works for you, just make sure that you do get your homeworks in. It is 20%, and I'm telling you, it can affect you negatively. And I don't want that for no one. And the other thing I suggest is those NCLEX questions, number 1, are preparing you for HESI and NCLEX. You should do them the best you can. And you could redo them over and over again until you get your best grade. But at minimum, if it's one of those weeks, you just got to get it in, get a 78 minimum. So it's not going to pull your grade down. It's just one of those hints I give you so that isn't what fails you. We know about late work. We know about NCLEX questions. We've already talked about them. Just make sure you turn them in the proper format. So if you take that little green box in that bottom right corner, print results, you save it to a PDF, and then you upload those 5, 6, whatever pages. That's what I want. I want to see what you've done, what question you've done, okay? And if you don't do it, you're going to see me put a 0 in that area. Now, it doesn't mean you got a 0 on it. I'm just trying to alert you to, hey, go back and redo it or send it the proper format, and I will send you instructions, detailed instructions on how to do it if you have not been able to up to this point. Or I can meet you. I can meet you on Zoom, take 10 minutes, get it done, okay? Whatever works for you. Again, NCLEX, do them as many as you want. They're there to help and guide you. At the end, week 8 and week 10 are the HESI practice and assignment exams. You know, those things are, again, through Canvas. You can't go to Evolve site. And those scores automatically transfer over into your Canvas shell, okay? Sometimes they don't transfer and you'll see a 0. There's always 1 student or 2 students every quarter. Let me know. I know how to go back and research and get your grades out. Just let me know, hey, I did it. But I mean, I'm going to check anyway, but you can let me know too. All right. CJ Sims. As I said, CJ Sims, don't just get the answers and put them in. You are failing yourself horribly. This is what we should be doing, those evolving case studies, knowing what they're saying. Why do you do this? Think about it. Take some time with them. That's only going to help you not only in PEDS, it's going to help you in MedSurg 2. It's going to help you in, capstone. It's making you think, okay? So take your time with them. Now, I do have extra case studies. Anybody who needs help with doing case studies, with me talking with them, I will do them with you. It's not a problem. You do have a paper, but I call it a project. It's 3 portions. It's due on week 8, and week 8's pretty busy between community, MedSurg 2, and PEDS. It's a very busy week, okay? I highly suggest people start early. And you're going to hear me every now and then, week 3, hey, that's, exam week, so it's not a good week, but maybe next week, pick out a diagnosis. That's a pediatric diagnosis. Your child has, your neighbor, your sister, or something you want to know about, something that's interesting to you. Virtual person is okay. It does not have to come from your clinical experience, okay? And it is 3 sections. First, and you will see all this details, the rubric in module 8. It's the paper's 250 words, not a lot. APA, make sure you use references and you cite in the body of the paragraph. And it should be about the diagnosis. Let's say it's cystic fibrosis. Tell me about what it is, okay? How do you get it, right? Then there is a assessment form. It's 11, 12 pages, but most is circles, okay? And the most important is the end, which will talk about theorists. It's going to talk about nursing diagnosis, related to, as evidenced by. Those are the type I want. So that's that part. And then the third part is teaching. Now, let's say cystic fibrosis is what you picked. Well, teach me about how to do chest PT, or what is the treatment for it, or what are the medications I would use, what exercises, ADHD, how to keep a kid organized, what meds I might use. Now, most students do a PowerPoint. I don't want a 20, 30 slide PowerPoint. No, that's way too much for y'all. 5, 6 slides. And what I want on there is concise, precise, teach me something. You could teach a nurse, and I've done that before when I was on ground. I had my students teach nurses diagnoses they've never heard of before. I had my students teaching nurses, or it could be teaching the parent or teach the child. So it could be a PowerPoint, it could be a brochure, or just a picture board of all information. Just make sure again there's references. Where did you get that information from? Now, because this is a 6% project and you're ADN students, I know that APA and all of this stuff is pretty newer to some of you. Hand it in as you do each section. You could put it right through the module. There's multiple uploads there. I will correct it, tell you what you can change to increase your score so you can get 100% on that homework grade. You hand it in early, I can do that. I can't do it on the last day, okay? I can't have all my students the last day. Hand it in before time. Just let me know it's there and I will go and I'll check it and I'll look at it. And if we need to meet because it's something going on, I'll work with you again, all right? So that is open now. So start thinking about a diagnosis. And yes, there's a rubric. You can use, APA. If you need help with APA, let me know. Now, Dr. Brown put these things down and talks about different things to think about. Are you prepared to take your HESI? Some students focus more on med-surg 2 or community because they're not doing so well and they don't do well in peds, or vice versa, community peds, whatever. So, if you just do the Q&A, listen to it. And I'm going to send you 100 question Kahoots. And let me tell you, all the concepts are in those things. You just got to spend a little time with them, okay? Um, Also, what we think about is not just as this is a school. We think of this as our hospital, and I'm the charge nurse or the doctor. And how are you going to communicate with that doctor, that charge nurse, that professionalism and telling me when things you can't do things or when things are happening? And that's how Dr. Brown thinks. Now, remember I told you about a student who was really successful and she talked about CJ Sims. And she talked to her professor last quarter at the end. So this is just, a month ago. And she got an 1145 on her HESI. And she said it's the CJ Sims and the NCLEX questions that really helped. Also, she would come to the professor, find out what quiz questions and what exam questions she got wrong. After exam 1, I don't care if you got a 90 or if you got a 70. I will meet with everyone. I mean, I was that kid who got a 90. I want to know what questions I got wrong, right? I mean, if you're like that, I am here to help you. And I won't, again, take up as much time as you want. So anyway, that was that student, and I think it was really valuable, and I included that in the PowerPoint for this quarter. Any questions yet? No, I haven't put you to sleep yet? Not yet? Okay, let's go to week 1. Remember, any questions, you stop me and I can help you. So chapters 26 through 30, a lot of information, but honestly, it's a broad overview. I call it an introduction to pediatrics. Now, I introduce Healthy People 2030. It's something I had no clue about when I went back from my BSN program. But basically, it started back in Clinton, I believe, President Clinton, and he determined there was health needs for, some of the disparities, which means the elderly, the younger, poverty, etc. And they made goals that they wanted to increase the level of health on them, whether it's oral health, their weight, nutrition, etc. If any of you are going on for your BSN or MSN, you're going to be doing papers on healthy people. So I've introduced it to you. It can be go and search part of it, could be part of your paper. Maybe you want to do something on, nutrition and the different ways that children can't or are intolerant to different things. Could be. There are problems. We know today children are eating more fast food. We know that children are more sedentary. They like their video games. I call them their electronic devices. And they'd rather sit there than get up and go out. Now, I've got a 7-year-old grandson that I basically raised for the first 3 years. And now his mom is married to the most amazing man. But I'm still every weekend I'll see this kid, and I've been involved with him. And at 7 years old, that kid will take my cell phone, go in the corner, and he'd be there for 20 hours if you let him. And you know something? Get up, get out, get on your bike and go right around the block and have some fun. Well, the kid is skinny as skinny could be, but many children don't have that opportunity. It could be where they live, they can, or parents. So 2-parent households today trying to make a living, barely making it by. And that's reality of life today. And that's why many of you are going on for your degrees to make it a little easier for you and your families. And I know that. Childhood injuries will be there, violence, vaping, is a big thing. It was a little bit bigger. They've slowed down on it, but it's there. And children do have mental health problems. Now, infant mortality. Kid is born, first 28 days of life, they're called a neonate. That little child there is young because the skin is pink. I would dare say it's a 26-weeker. I dare say, oh, no more than 900 grams, probably more like 750. Very, very small, pound and a half. Now, when they're born that small, there's so many things that can go wrong. Number one, their lungs aren't developed, their GI tract isn't developed. They have very fragile vessels in their brain and they can get brain bleeds. And, infant mortality, which is the first year of life, is higher in the United States than many other countries. We haven't caught up to places like Switzerland. That's one of the best neonatal or infant mortality rates. And we know a lot has to do on that weight, and you can understand, I just told you why. Death rates for children greater than 1 are less than infants, of course. They already have their immune systems. They've already gone through that first year. They've got their immunizations. They're having their nutrition. We've already keyed on what's going on, so they're better. And then 5 to 14, those kids are just in a routine. There's just school age into early adolescence. But then all of a sudden in adolescence, they're like, I'm old enough now. I can do what I want. They have no filters. They get injuries like, for instance, they get their driver's license. Somebody climbs on the hood of the car and they ride them around parking lots and they fly off, or they get into their father's gun. And they're just all of these behaviors just because they're adolescents and it's, part of that group of children. And the other thing is suicide. And the reason is adolescents are all about body image, that they don't feel good enough. They feel less than. So suicide is huge. And then, of course, we have the homeless, the poverty, low birth weight, chronic illnesses. Those are going to be your high levels that are still with mortality. Picture says 1,000 words, doesn't it? Guns, suffocation. I live in South Florida. I live in Homestead. I am 30 minutes from the Keys. And I've got a pool in my backyard. I've got a 7-year-old grandson, don't I? Well, at 2 years old, he was doing front flips off the diving board because I taught him without swimmies, he knew how to swim because I was so afraid. But even that, he will not go in the water until he asks Nana or Pop if he can go. So it's a big thing in South Florida. pans on the stove. I had a brother whose whole arm was scarred for life because of oil that went there. And then, of course, they're always getting in medications. You know what? The biggest one that I used to see, my last position was at Nicholas Children's emergency room, and I did a lot of triage. And children coming in, they love their Flintstone vitamins. And Flintstone vitamins actually is not going to hurt them unless it has iron. That's why they don't usually put iron in those vitamins. We know Tylenol, and they love to chew those chewables, right? That would be more dangerous. But children love to get into them, and they do. So earlier I was talking about what is nursing, especially with children. It's all about family-centered care. And the family is the center of their life, and they recognize, children know that the family is the center of their life, which means what they know, how they behave, how they dress, how they act is because of the family. The family makes them who they are, right? Now, what is a family? Whatever they say it is. There's all types of families. You know, initially with my daughter, it was me, my husband, my daughter, and the baby. That was our family. I mean, now she's fortunate. You know, she has a husband and, you know, he adores that boy. I mean, in fact, he thinks that he's the father because he's been with him for so long. Anyway, families, whatever. They are so many. 2 girls, 2 boys, Nana, Pop Pop, adopted, all sorts of things. Nursing. Now, many people that are in nursing don't want to work in pediatrics. And the reason is parents. Parents are rough. Now, why are they rough? Well, they just want to know all about their kids. They want to take care of their kids. And you need to develop a relationship that they can openly communicate. You need to be there to teach them and how to keep their kids healthy and free from injury. And that's the nurse's job. As a nurse, providing care to this child as atraumatic as possible. Now, any of you get an IV, go to the ER, get an IV lately as an adult? Do they put any numbing cream on your hand, your arm?
No.
Absolutely not. They want you to hurt. I don't know. In pediatrics, we numb it. And we numb and we do as many things as possible to decrease the amount of pain, stress, and anxiety. Now, my dissertation is all about school-age children's attitude and behavior towards injections. And what I did is I developed a program which is used in this big hospital organization called Huggies. H period, U period, G period. It's copyrighted, it's mine. Help us give great injections efficiently and safely. And what I propose is that a child has less fear, stress, and pain when held by a parent before, during, and after an injection. And I'm telling you, it works. So we numb the stuff, right? We do all that. Then we have, where is the child most comfortable? Held by mommy, right? And it shows that we're giving that atraumatic care. If you want to look it up, you can go Google, put Huggies, it's going to be there. So it's all about no harm. All right, children, religious, and families, etc. As I said, there's all sorts of families. There could be blended families. It could be all different things. I mean, I could go on and on about what types are. One thing about families is the nurse, we have to be that person in there, almost like they're counselors, it seems. We need to understand, what does the mother need, the father need, the grandmother sometimes the aunt, and the child all need, and what is their role, and how can we teach that family to give that child the best care that we can, because our bottom line is giving that child great care, right? We know that around them, they are all influenced. Now they have family and then they get older, right? And then they go into school. and then they're part of churches, and they, as they get older, they get into little peer groups, and then they're into, all that social media stuff. And all of this stuff now is changing their mind, and their minds are not just family. They're becoming, more well-rounded in many things. Not all good, but it is life. Understanding their race, ethnicity, um, helps sometimes, and it's how you deal with different cultural things. I'll go into some of those in a little bit. Poverty. How are you going to teach a kid, who's doesn't have money? I mean, that would be a person I'd get social worker in and see what help I can get them to get them their medicines or get them transportation to get to those appointments they need. I mean, all of these things as a pediatric nurse, even as an adult nurse, sometimes you need to think about, right? Where did they come from? Then religion and spirituality. Now, as a person, now I know what my religious beliefs are. I do not have to accept or understand another person's, right? But I have to give them the time that they need to be, or give them whatever they need to practice what they believe in. Understand that? It's, I know me. I don't have to be what they want me to be. I just got to give them that opportunity, whether it's, that 6 prayers a day, or whether it is nutritional, they don't eat meat. All of these things I need to remember as a nurse to take care of my patients. So, a frequent health problem of migrant children and adolescents. What do you think? Migrant children. Tuberculosis.
Tuberculosis.
Yeah, and I've seen it a lot here working in South Florida. There's a lot of farms, and there are a lot of migrant workers that come in, and I have seen tuberculosis down here. So, cultural beliefs. Now, we have all different cultures here. I'm multicultural. My children were from a mom, their father was Cuban. I am married to a Jamaican man. And some of my best friends are Dominican, and I could go on. And then my other friends are Haitian. So I've got so many cultures that I've been involved with. Now, I'm from a little small town in New York where we didn't have those cultures. But as a nurse, number one is how I got indoctrinated into understanding and have like a thirst and knowledge to understand other people. I mean, I don't have to accept practices, but I like understanding people so that I can better care for them, right? We know that sometimes special foods, not, vegetarian, sometimes it's the clothing, or sometimes it's how I examine a child, not undressing them all the way, just undoing where I need to with the sheets, because they're very private, right? Understanding, giving those times again for those prayers, whatever they need. There are some things that I've heard, that I hadn't before I moved, and I was from a tiny town in New York. Um, the special forces with rain and cold air, they say if you go out in the rain and you get wet, you're going to get sick. And I'm like, okay. Or if it gets cold, you're going to get sick. And all right, well, if that's what you believe, I'm not going to go against it. All right. That's why my kid got sick, because he was out in the rain the other day. I've seen things with supernatural, voodoo, witchcraft, or evil spirits there. I don't know what it was called, but I had this gentleman, and this is an adult patient, but it could have fed right into the pediatric world, where he was very sick in the surgical intensive care unit. And the parents, the family, whoever, wanted to come in and they wanted to do this practice. They had this dead chicken and some beads and some, drums and whatnot. And they said, "Do you mind if we have some time alone?" I was like, as long as it doesn't interrupt with the patient's care, right? Pulled the curtains, they did whatever. In fact, I was pregnant and they made me put a quarter on my belly button because they didn't want evil spirits to get into me from that patient. Now, this man was sick as sick can be. He was a ruptured colon. I mean, he had peritonitis. He was really sick. Do you know the next day, this man started getting better? And in 3 days, he went to the floor and was home within a week. It was amazing how quickly he turned around. And what was it from? I don't know. I'm just not going to guess, right? Hot and cold. I know some people, some religions believe, or even cultures believe, that you shouldn't be walking on tile floors without socks on because it's going to make you sick. Um, there's so many things, that I've heard today. And I talk to these parents regarding these things. Now, religious beliefs and giving the opportunity for sick babies or sick children to get baptized, or whatever religion they are, opening up, do you want your person to come or do you want us to call ours? We always had at a hospital, the variety, the rabbis, the ministers, the pastors, whoever would come in at all different times. Well, what about Jehovah Witness and blood products? Now, pediatrics, let's go back to that premature infant. Premature infants do not make blood yet, right? They're not going to make it up to almost 6 months, start really making their own blood. About 3 to 6 months, mom stuff is going, and now they're start, making their own cells. Well, a premature infant, we're taking blood, we're looking at electrolytes, CBCs, all that stuff, right? And that blood's just not being replaced. It gets to the point where these children's hemoglobin hematocrits become very low. Could be 7 and 21, and it should be 12 and 36. At least 10 and 30 would be the lowest, right? Well, with a Jehovah Witness, we can get a court order to give blood to the child because our goal is the safety of the child. Without blood, these children become symptomatic. They get periods of apnea, bradycardia, and dangerously, they could die. So we have to replace the blood. It's as much as I know what happens, and I've been told by these families, they understand it has to be done, but they don't really want to, have a visual of it. So what do I do? And what have I done? Well, I gave it once at night, sent the parents home first, then gave it, and that was the easy one. Well, I had to do one during the day where I pulled the parent out of the room. I brought the blood bag and all the stuff hidden in a blanket into the room, pulled the curtains, checked it with a nurse, hung it up, put all that stuff away so there was no blood sitting anywhere, covered the IV pumps so the parent didn't have to see it, and then let the parent back in. When it was done, pulled them out, got it all out, wrapped it, threw it away, and they never saw me giving the blood on that child. Well, to tell you how powerful that was, 18 years later, believe it or not, this mother found me in the emergency room. And she said, "Oh my goodness, I've been looking for you for so long." She says, "What you did that day made me feel so special and like you really understood. And I've always wanted to thank you." And the kid is now 18, really bad cardiac kid. So it does make a difference. Just those little things, the respect of those religious things, whether we understand or not, I don't have to, but I have to respect what their wishes are, right? Again, nurses were, that person between the doctor and between, the parents and the child. And it does, all of our teaching does make a difference and it does help. So, leading cause of death among African American boys ages 15 to 19. So these are your adolescents, right? What behavior here do you think is going to be number one?
Would it be C?
C.
Yes, it is. It's firearms. Now, the second would be suicide, but yes, very good. All right. Growth and development. Well, let's look at an infant. This is the way I think I describe growth and development the best. A baby is born at 7 pounds. They can't lift their head. They can open their eyes and look, and they don't even really talk yet. They can cry. That they can do. By 1 year old, they've tripled their birth weight. They're talking. They're almost walking if they're not already walking or running. It is this growth, development, it's interrelated, simultaneous, ongoing. There are gross motor skills that you're going to read about for next class, and there's fine motor skills. Remember, gross motor skills is G. Get up and go, go, go. It's movement. Lifting the head, turning from the belly to the back to the belly, getting up on their knees, crawling, sitting, then it's standing up, creeping, and then it's attempting to walk steps, if not walking by 1 year old. And then fine motor is how we use the hands. F, fingers. That's how you remember the difference, with these questions that you're going to see. First starts with that mommy puts the hand inside their crib at birth, and they take and they grab their finger and they go, oh my goodness, my baby's hugging me. And you're like, oh, it's a reflex palm or grasp, but I'm not going to tell that parent it was a reflex, right? Later on, you give them a little rattle and they grasp it. That's a voluntary palm of the hand grasp. And then it gets up to sitting them in a high chair, and you put those little puffs or Cheerios or whatever in front of them, and they sort of take their fingers and smush it, and it's what we call a crude pincer grasp. Then it gets into that fine pincer grasp that they take it, right? Then with their fingers, they can take blocks in and out of a container. And then by age 1, they should be able to take 2 blocks and put them on top of each other. Now, it doesn't mean there's not 4 blocks for some children or 5 blocks, as long as it's moving forward. That's the minimum that we do see. So growth, development, maturation, differentiation is all about growing. Now, did you all get the week 1 handout that I sent? Were you able to open it? Anybody?
I was able to.
Yes.
Okay, very good. One of the other professors made that, and it's going into a bunch of these different terms, and it's a matching, and I love it. It's those key terms that you're going to need to know for exam 1 and for quizzes. So it is an extremely good handout for you. So again, there's different ways that we grow, and then we know all children are different. You have parents say, well, when my daughter was 8 months old, she was already walking, but, my child is, just sitting and starting to stand up. And you're like, well, by 8 months, it should be sitting unsupported. And if they're doing that, they're meeting their requirement. They're moving forward. So they're all different. You also got a handout on vital signs. And all vital signs are slightly different, the numbers that you see. But in pediatrics, we need to know what each child and what vital signs are normal to take care of them. Is it, for instance, a neonate's heart rate, 140 to 160, normal. Respiratory rate, 40 to 60, that's normal. Now, what if their respiratory rate was 80? Well, that's too fast. What if their heart rate was 200? That's too fast. And then you have to think, why is it too fast? Are they dehydrated? Are they in pain? Do they have a fever? All those things causes an elevated heart rate, you see? And if we didn't know normal heart rates, or blood pressures even, we wouldn't know to look. What if you're giving digoxin to an infant? What do you know what that low number is? It's 60 in adults, right? That you would hold it. Well, it could be an infant, could be not less than 100. So these are things, vital signs you need to understand. Remember, heart rate starts up and works down, and blood pressure starts 60/40 for a newborn. Then it goes up as an adult to the 120/80, quote, normal. So those are things to think about. At birth, babies are born with a lot of extracellular fluid, and with that, they tend to get cold really quick. So those children, if you ever noticed at birth, if you've had children, they completely wipe them off and stick them under a radiant warmer right at birth because there is that chance of them getting too cold, and we don't want those sort of things. As they get older, they need less clothing and more like what we wear on a normal basis. But initially, they're going to need more help. We know infants sleep a lot, rest a lot, nap a lot. And then here we go, nutrition, the single most important influence on growth and development. They're not fed properly, they're not going to be where they should be. They're not going to have the fine motor skills, cognitive skills. They're not going to have those motor skills. So these are things that we need to look at. Now, nutrition. How do we measure nutrition? Well, when they're born at 7 pounds, by 6 months, they double their weight. They should be 14 pounds. Well, what if they were only 10 pounds at 6 months? Or what if they weren't doing all of the turning over from front to back, lifting their head, and they're not cooing like they should? Well, we're going to look at nutrition, number one, right? Those things are telling us the kid's not getting nutrition. And if we let that nutrition slack for too long, it'll be permanent. So we need to make sure we get that nutrition the way it should, maybe increase calories in whatever, breast milk or in formula, and get them maybe therapy that they need to catch them up. These are things that we do. In pediatrics, and if you have children, every visit there's a height and a weight. Every visit there's a height and a weight. Number one, they're measuring nutrition. Number two, it could be all about the growth hormone, thyroid hormone. There's all different things that are affected by height and weight in the body systems. We're going to be going over those this semester, okay? So height and weight, one of the most important things on a child that you can evaluate so many problems and react to them before it becomes a permanent problem, okay? We have all sorts of kids. We got the easy kid, we got the difficult kid. That is what we see. Now, I've also sent you a handout on theorists. The first exam's going to have a lot, and then you're going to see them sporadically through the course, and you'll see them on the HESI. Now, what's a theorist, and what do they talk about? Well, Freud talks all about sexual type of things, and we're going to go into that. Erickson talks about how they act, why they act the way they act. Piaget is thinking how they take a little thing like grasping on a rattle, and then they shake it and they hear a noise. Now they know a new thing to do. Now they're shaking the rattle. First, they had to grab it. That's the simple. And then they shaked it. And then what does an infant do? Puts it in the mouth because everything is in the mouth. That's oral, which is what Freud says. Kohlberg is all about right, wrong, and a consequence for either. And children know that from an early age. And then you might see about Fowler. It's all about their spirituality. Now, every single group, when we go next week to infants, toddlers, preschoolers, and the following school age and adolescents, we're going to be going over these theorists and what they mean to all of those age groups. Something that I try to put in a manner that's understandable for you, okay? Little words and tricks that I tried to say. Now, Freud is initially it's all about oral. Well, how does an infant self-soothe? Well, what is that little thing they put in their mouth? It's called a self-soother or a pacifier, right? or it's the thumb, or it's a finger. That's what, or that rattle. Everything in the mouth, they explore the world through their mouth. That's all what he talks about. Anal, well, why is it anal? Well, that's potty training. And bowels are always trained before bladder. It's easier to control. Phallic, they're starting to learn that there's boys and girls. Latency is all about same-sex peers, friends, and then you get to be in adolescence and it's all about their genitals, right? This is all about building relationships. Now, Erickson, probably one of the most tested theorists in all of them, him and Piaget. Those two really pay attention to. Now, at birth, a baby, all they can do is cry when they want you, right? And when they cry, what do they want? They're asking for you, aren't they? They're telling you, I'm hungry, I've got gas, I need my diaper changed, or I just want to see somebody, right? So when they cry and somebody picks them up, they have trust. They feel good. They're happier, well-rounded children because somebody gets them. There's nothing to worry about. Well, there are some relationships due to many reasons where those children's cry, nobody ever picks them up for whatever reason. That is the one that's going to be a more unhappy child, sometimes even a quiet child who wouldn't even cry because why cry? Nobody's coming anyway, right? They call that mistrust. And then we're going to go into the rest of them as we get up into next week. But these are those things in the theorist. Now, Piaget, the first 2 years is that sensory oral motor. It's all about touch, mouth, and movement. Wasn't that rattle I just said? I touched it, that's my sense, in the mouth, and I'm shaking it. It's all about experimenting, moving things, seeing things. And as younger children, they need to see it to understand it. As they get older, as an adolescent, they can figure things out without having to see it before. And we're going to go into how adolescents are just so brilliant, making mom change your mind to let them go out to their friend's house on a Friday night when she said, no, you're not going because you did whatever. Adolescents know what to do to change your mind. So cognitive development, language, they're born with that. Cry, they know how to talk to you. And then they get to cooing, and they even start with their language. You make sounds to them, they're going to make sounds back at you. Kohlberg, as I said, there's different levels, it's different ages, but all of it has to do with right or wrong and a consequence for either. Now, play. Do you have children or no children? What do? 24 hours a day if you let them. They're going to play with whatever, right? Well, there's different types of play and there's different names of them, okay? It could be social with other people. It could be sense pleasure, which is like sand, mud, stuff that's texture that you can touch. Skill, building up blocks or making a train set. Unoccupied play, behavior, just sitting there alone. And then you get into that dramatic pretend play, and we're going to go into games. Now, all of this play is a sensorimotor development. That's number one. It teaches them how things work. And as I said, they build upon the little and they make it more and more. I mean, they figure out that all of a sudden, if you take these 2 Lego blocks and put them on top and straight up, it works. But if you put them on the side, they tip over. Again, this is all learning them. It's all about the intellectual part of it. We know it's children get together and they play, it's social, and it's all about, as they get older in play, it's that morality and the sharing of toys. And we're going to go into the types of play and we're going to show how we get to that, being able to share. So onlooker play is kids looking at another kid playing. period. Solitary play, you play alone with your own toys. Toddlers are the parallel play. Children that are 1 to 3, toddlers, tend to play with their own toys, and then the other kid with their own toys, and they don't share toys. They want to play by themselves. They don't. Me, mine, okay? Then they go to the point where, as they get older, playing together. But it's just playing together. There's not any goal for them. They just take blocks and they play with them in cars and they talk and they have dolls flying around and whatever. That's associative. Now, cooperative play is when there is a goal, like something you win, whether it's a board game, that's easy, or let's build a racetrack and put it together and race cars. Well, that would be cooperative putting together, and in the end, you race a car. Important to know the names of play. Play is important. Why? Well, for instance, you put little toys down, and that child that sees it, they're going to try to scooch and move and try to get to it and get it, right? And that's working their muscles, the pushing, the pulling, the rolling, and it helps their muscles develop, okay? Also, with these toys, it's parents playing together, right? I mean, I used to like to play the drum, and Kristen used to like to ring the bell, and we used to sing a song together, and he would smile and laugh and ring the bell, and then he wanted to play the drum, okay. And it was something developing together. Now, assessing children all depends on ages, and it's also their cognitive developments too. I mean, you see the bottom left-hand picture, looks like a child has cerebral palsy, just by the way her neck is proportioned. Now, her assessment's going to be different from the girl on the right. And there are different sort of forms every hospital to look at. But again, we need to see, are they developing the way that they should? Do they, as an infant, by 6 months, are they rolling over? By 8 months, are they sitting unsupported? By 12 months, are they at least standing up, attempting to walk? All of these things are important. What if a child 12 months old is not even sitting up unsupported? Well, that's a delay, isn't it? What do you think we should do? Well, that child's going to get early intervention. What is early intervention? That is introducing either speech, physical, occupational therapy. And what's beautiful about pediatrics, these children catch up really quick. All sorts of congenital abnormalities can be there that we have to work our parents through. Just to let you know, we're going to go into some of those more as we keep going. We know that genetics is a big thing. Sometimes we have to encourage parents to go get genetic testing because of syndromes that they have, and this is the nurses saying, you want more children, letting the physician know and getting that done, that genetics, especially if we know it's something that is genetically passed to the parent, from the parent to the child. We know there's all different other stuff that can cause problems. It could be the medications they had to take, or it could be, illegal medications that they've been taking. And of course, again, there's all sorts of genetic disorders. When you think of genetic disorders, you think of Downs, right? That's chromosome 21. That's the common one. Well, Q222 is a DiGeorge syndrome, so there's so many more, and we're going to go into some of those. Again, what does a nurse do? I can't describe this and tell you enough. We're all about giving the education support. We're there to see that parents are struggling and to let them know we see it. Sometimes you got to give them a hug, and I was the biggest hugger. If you're not the hugger, just be in there and being verbal sometimes is all you need to do. And getting that kid to work with you, that attachment. I've got so many kids that I raised, as I call it. I called them my kids when they were in the hospital. I said, I'm sorry, mom and dad, while the kid's here, it's mine, sorry. And they're like, it's fine, you can have my kid while he's here. I mean, of course, the parents were there, but we had such a connection. And what did that do? It allowed me to give better care. And the kid would do, let's say, doing inspiratory spirometry better and coughing deep breathing and walking down the hall or whatever had to be done, they did it better because we had that connection. Remember, there's always HIPAA. Be careful with all of your information and know that an 18-year-old, if they're cognitively aware, will sign their own consents for treatment. And you must ask the parents, the child, if the parents can have that information and can we speak in front of the parents freely. So it's an important thing that that is different between adults and children, because usually you figure kids, you talk to parents, not an 18-year-old. Talking with parents and children, remember, keep directing the focus. Sometimes you have an 8-year-old and they want to tell you what happened from birth on, and it was a normal birth, normal illnesses. I say, okay, so was born, good APGARs, went home in 2 days, okay, and all right, today, what's going on? Being aware of culture. Sometimes you can't stare in the eyes. Sometimes you have to get space. You can't be that close to some cultures, and being aware of those things. And of course, being silent sometimes, just listening. And this be empathetic, that's like that infant who comes in, who's been sick for 5 days, and mom's working and not sleeping. And you can see those poor bags, and she's in tears, and I don't know what to do, and he's still sick. And saying, wow, mom, you have really done a great job. Okay, you're here with me now. Let's take care of your child. You did good. Let's see what we can do. And just for a nurse to tell a parent that, you're going to see that parent trust you more. You're going to see shoulders relax. Like, oh, okay, I have somebody who understands how I feel. Because you have a sick kid at home. It's not easy, right? Also, when you're doing a patient, a child, a parent that doesn't speak your language, do not have a family member interpret for you, because they're going to give you the interpretation, but with their understanding of what they said. Those blue phones are great today. Talking to kids. Well, how do we talk to kids? We're going to talk about this quite a bit. Well, first of all, children, you can't go in and immediately think you can start doing vital signs and talking and they're going to answer. It's not going to happen. They're afraid of you. Think about this child. Every time they've gone to the doctor, what has the nurse done? Usually given them immunizations, injections, and they don't want that. And they don't want the medicine. So what do? Now, I worked in an ER, and many times I would take the step down area because I just love playing with kids. And I'd have 4 rooms, and I had 4 kids that I had to take care of. And I had to get treatments done, IV started, blood drawn, whatever had to be done. So, what I would do is, now you see this doctor or nurse, whoever she is, sitting on the bed. I would do something better. I'd sit on a chair below the child. Don't ever be above a child. They feel you're towering and it's threatening. Get below them. Then you're going to go on their developmental level and open a conversation. Well, that little boy has a heart on his shirt. And I would say, wow, you got a heart on your shirt. Do you know you have a heart in your body? Where is it? Now, I have started a non-threatening verbal, right? And usually kids will be okay with it. I also always had stickers in my pocket, whether princesses, whether Spider-Man, Superman, something. So these kids, now I'm a non-threatening person. And before I did anything, I explained it to them. So they knew what was coming, what to expect. And of course, I had mom there to hold their child in every case except a spinal. And sometimes in spinals, if that child really needed it, we would gown and glove up the parent too, just to be there by the head of the bed. When you're in doing a history, especially if you have multiple people coming in, find out who you're going to talk to, because sometimes you'll have 4 different people answering the same question. So get one person, find out what's going on and what are the symptoms you're coming in for now. You do know quickly, brief, what was their birth history? What do they eat? Any intolerances, allergies, right? And of course, medications. What have they taken? If they're being admitted to a hospital, you need to know when they last had their ibuprofen, their acetaminophen, or if they're on antibiotics, and when did they last take it? And an important thing is, are they up to date on immunizations? You get a young child in who's not been vaccinated, who has an upper respiratory, you can't just assume it's just a viral. It could be something like pertussis. It's just extremely infectious because they haven't been vaccinated. That child will be placed in a separate private room. So very important. And then, of course, we're going to look at that growth and development. Is that child using their hands? Are they head lift up, right? And then habits. Do they have a blanket or a special doll or something that soothes them? What if mom has to step out, run to the cafeteria, go to the bathroom, whatever, and that child's crying? A nurse is going to walk in, right? So you need to know what will that child help that child. Little Christian, he had a blanket, and then we had what we called Mr. Puppy. And Mr. Puppy was one of those little beanie baby giraffes. Why we called it Mr. Puppy, I don't know. That's what he named it. But if he had that, nothing else mattered. Again, getting histories, and you get up to the point of adolescence and getting sexual histories. We many a time will have parents step out of the room and talk to that adolescent. Again, getting on their level, on their developmental level, creating an open communication, and then they'll speak with you too. There's ways to do it with adolescents too. And again, knowing that family structure will help you take care of that child better. Like, who am I going to talk to? The family health history, if there's, a kid who's coming in and we're seeing maybe it's diabetes, right? We're seeing a high blood sugar, knowing about that family history might help. Psychosocial, kid at school, I always would say, so how are you doing at school? Do you like school? What are your grades? They say that, well, I got a C in this class. I said, yeah, but you passed. You're going to do better next time, right? Not ever putting a kid down and always accentuating the positive, right? Also, going through a review of the systems. Now, it's not going to be from head to toe. We're not adults here. It won't happen. Another part of the history is knowing about their culture, and it could be about dietary input. Also, it could be an infant who's weighing 10 pounds at 6 months. So we know there's a failure to thrive. We know they're underweight. What's going on? Or what if you have a 10-year-old and they weigh 150 pounds? Well, what are they eating again? And all of those are food diaries. What did you eat yesterday? And trying to help them, do what they need to lose weight. Maybe it's increasing activity, right? Physical assessment, head to toe, forget it. Not going to happen. An infant's asleep in a mother's arms, you're going to listen to the heart, you're going to listen to lungs because they're quiet. And if you're lucky, you might get to their abdominal bowel sounds, right? Now, you don't think you can do it all at once. It's not going to happen, but you try to focus first what they hear for, and then do a little bit of the assessments at a time, okay? So children, preparing them, what's going on, getting that relationship, using dolls, showing them equipment. Here in Miami, at the hospital I worked at, they have a child life team that's amazing. Even in the ER, they're there. And what they do is they prepare children for stitches, for IVs, for getting casts on, whatever. And they are very well educated, a minimum of a bachelor degree. They're taught all about growth and development and child psychology. And let me tell you, they really, really do a great job. So what approach would be best to use to ensure a positive response from a toddler? Isn't it a minimal of that eye level position? Talk quietly. Don't scare that kid. Let them feel that you're calm. You can't pick a kid up. Ain't gonna happen. And I'm your nurse. They're gonna scream and run the other way, and you're never gonna stand above a child. Examining a child, as I said, children have been, especially the older ones, they've had all these injections. They don't like them. All physicians' office are different. Some use numbing cream, some don't. Some will let the parent hold them, some won't. So we don't know what's happened to them before. So again, try to have parents help you with it. That Huggies works really good, and teaching and getting that child prepared. All of the measurements, remember, they are all in the size of what the adult is. Now, as I said, height and weight are done all the time. And it's for many reasons. It's for nutrition and it's for a lot of metabolic disorders, et cetera, et cetera. Blood pressures, is a big thing. You can have a blood pressure on a 1.5 pound baby, and it goes around, the blood pressure cuff goes around your little pinky. I mean, that's a little how small they are, and they can go up to really, of course, extra large for my arm. Looking at the kids, the skins, and all of these things, lymph nodes on children, you shouldn't see them unless they're sick. Lymph nodes shouldn't be there. You're going to look at their ears, their nose, their mouth, etc., listening to their lungs. And again, you're doing this when the kid will let you. Inspecting, auscultating, palpating. There are ambiguous genitalia, which means male and female parts sometimes. Sometimes genitalia, we have fused labias on females. These are things. What if you have to do a urine catheterization on a fused labias? It's very difficult. So these are things that you would check out. At birth, you've been taught to take a rectal temperature on your baby, right? Well, it's because sometimes there is no anus and it can happen. Looking again all over the body, seeing if their reflexes are working. Usually they're the moro, that noise, that quick touch, you'll see their hands splay up. Measuring them, usually your young children, you're going to do head and abdominal circumference. You're going to do that every shift or every feed, abdominal circumferences, to make sure that the food's going down there. Know that the chest and the head should be equal to, or the chest bigger, by 1.5 years old. We know that they're born with big heads. They do catch up. Now, do you think it's easy to get a child that age to go underneath a thing to get a height? They're afraid. Oh my God, they're afraid. So I've made a game of it. So I would go under it and I'd say, okay, what's my number? Because usually there's a little number on the side. So, oh, I'm a 7. Here, can you hold it and put it down to your head? Here, you do it. Okay, what's your number? And they'll say, well, I'm a 6. I go, wow, I love that number 6. Or else they think it's going to come down and bop their head. And it can be scary. So again, you play with children. Every day I went to work and I played. We do the blood pressure cuffs just like adults, but look, I like doing most of those toddlers and preschoolers on D, on the lower leg. It works well, it's less threatening, and it doesn't hurt as much. And I can distract them up here doing many other different things. Distraction is a big thing in peds. Pain assessments, one of my biggest pet peeves in pediatrics is that most nurses are afraid to medicate because children many times won't tell you they hurt. Why? Well, they're not going to tell you they're in pain because they don't want a shot, they don't want a needle, or they don't want the medicine that tastes icky. So they're not going to tell you. So they suffer. Also, they tend to wait too long. Adults don't, but children, they will wait. We have Wong's Baker and we have numeric. There's other ones here that we talk about. Here's faces. Now, faces, they have to be 3 years old in order to use this scale. I'm telling you, children do not over exaggerate pain like adults do. They will give you an honest answer. So if they say it's a number 6, they're hurting quite a bit. Now, younger children up to age 3 and nonverbal children, they can't tell you, they can't show you, but what they can, their body, the way that it's moving and the way it's looking can tell. So, facial expression. What if I'm grimacing, right? Legs, what if they're just moving in and out or just not moving at all and they're stiff, right? That's the activity too. What if they're crying and you can't console them? That kid is in pain. A nonverbal kid could be a cerebral palsy 18-year-old. They don't talk. Many of them are nonverbal. So flax scale works. There's also cries, and again, there's faces again. Pain could be due to anything, right? Doesn't matter. It could be earaches are probably the biggest of all kids and sore throats. You know, children do have chronic, reoccurrent, persistent. We have children who have sickle cell, which is a lot of pain, and other different rheumatoid arthritis. We know that if you do not address pain and take care of it, it does function, does get into every part of this child's life, physical, emotional, social, and in school. Those non-communicating pain checklists, yes, they do have them out there, but flax scale works good, but some hospitals use that one. And in children, and we could do this in adults if we think about it, using distraction of some sort to get their mind away from the pain, give them their medicine, let it work. Children, distracting them. It could be giving them crayons and a coloring pad or turning on a TV program or giving them a video game. Or I would turn on music and start dancing in front of them. And I have my arms going up and down because if that doesn't hurt them. Those things, giving them stickers, puzzles, it doesn't matter. Distract them, it works. I mean, this infant is a premature infant and she's having kangaroo care right now, skin to skin. I'm guaranteed that that kid who was up in an isolate or on a warmer was irritable all day long. Heart rate up, blood pressure up, burning calories like crazy, right? Mom comes, puts it on the chest. Those kids fall right to sleep and have the best sleep ever. It's calming. They're used to mommy's heartbeat, right? And it's not just giving them morphine or pain medicine. It's that ibuprofen, acetaminophen, hot packs, cold packs. It's positioning, right? All of these things work. And older kids can have PCA pumps, and they do work when they're instructed well. You know, this girl here, she's smiling, and she's got that white glob on. Well, what that is a numbing cream called Emla. And she's going to get her blood drawn, but she's not upset. And why? It's because she knows it's not going to hurt. So again, it's all these pains and taking care of them. One of the things about pain in your infants, think about you're going to be doing, and this happened to my grandson. He needed a circumcision because the foreskin was so tight it wouldn't come down, and I couldn't get it down. So they had to do it. And they did it only with a pacifier with sugar water on it. And in my research, a Harvard neurophysiologist said that it is just as potent as morphine, that sugar water with a pacifier. So it does work. So make sure we treat them. So, which of the following is an important factor for consideration in understanding the pain experience in children?
B.
Yeah, they're
B.
not going to admit it.
B.
Yeah, they're not going to admit it. They don't want it. Afraid. They're just totally afraid. Any questions so far?
I don't have a question, but I was gonna add they took a sucker when my son had his done and dipped it in water. So it's the same concept, but it worked.
It's oral. It's that oral
Yep.
soothing self-satisfaction. Also, breastfeeding works too. Some parents, you know, believe in that. And if the doctor's okay with it, well, why not? You know, whatever works, whatever parent wants, because some parents don't want the pacifier, although they've proven that it's more beneficial. I mean, in my age, I've seen them good, bad, and they're up to the point where they believe in them again. So, all right, let's go and do some cahoots. How does that sound? Have you done a cahoots before?
Yes.
Okay, what you do is you go to that little thing there, put your camera on it, click on it, and it'll open up right where you want it to be. You know, I just learned about that last quarter. You could put your phone and click there. Put your phone camera on, and then click on the website that shows up. And you'll go right to the game.
Hi, I have a question.
Excuse me?
Yeah, I have a question. If I do it with my camera, it will kick me out from the Zoom.
All right.
Yes,
Do you have your computer on?
my computer is on, but my camera is locked. It cannot show the video. I don't know what
Okay.
happened.
Okay.
That's why I'm using two devices.
Okay. Just listen to it right now, okay?
Okay, thank you.
Anybody else trying to get in? All right, let's get going. Week 1. It's going to go by quick. From a worldwide perspective, infant mortality in the United States. What did I tell you about infants dying in the first year of life? It's the highest. It's more than most other countries. You know, we've still got a lot of work to do. The leading cause of death from unintentional injuries in children is. Now, some of these things I haven't covered yet, but these are things I'm bringing to you through a cahoots. Everything can't be covered in a PowerPoint.
For some reason, I couldn't get in, so I'm just.
Okay, then just listen for me.
Okay.
So one of the constant things that all children do is they're in a motor vehicle, right? Whether they're in it wrong, run over by cars, I've seen that also, or now they're driving cars, right? Motor vehicle, number 1, unintentional injuries. Which statement is most descriptive of pediatric family-centered care? It's a constant in their life, absolutely. That's the one thing children know. As they get older, they start to know a little more. The major cause of death for children older than 1 year is. You think of a kid who's 1, toddlers, I call them my dive bomb kids, and they're jumping off of things, missing couches, falling on their heads. That is that unintentional injuries, is things that just happen in their explorations. The nurse caring for a child in pain understands that distraction it has to be on that child's level. And it doesn't give total relief. What it does, it refocuses them. So they're not sitting there just thinking about pain. gives them something else to do, but it has to be developmentally appropriate. Everything with children, developmentally appropriate. In what type of play are children engaged in similar or identical activity without organization or a mutual goal? That means nobody wins. And that's called associative. Now, parallel is next to each other, playing with their own toys. But when they say engaged in similar, it means they're together. That means associative, but there's no goal. Nobody wins. It's not like a board game. It's not like they made a racetrack. It's just they're all playing with toys together. That's all they do. That's associative. Which statement best describes the process of critical thinking? It's purposeful, it's goal directed. I mean, we do it every day. I mean, you're thinking, okay, what's for dinner? What am I going to do? Do I have to go to the grocery store? What do I have home? What can I pick up? I mean, this is all critical thinking. And the goal is what we're having for dinner. What is probably the single most important influence on growth at all stages of development? Nutrition, nutrition, nutrition. You don't give fuel to the tank, it's not going to grow. Nutrition, most important. Frequent developmental assessments are important for what reason? So stable developmental periods can identify delays or deficits. You know, when you're seeing something where they shouldn't be, you can get early intervention and get these kids caught up. So we're always figuring out, are the kids where they should be? What function of play is a major component of play at all ages? I mean, what does play do? What is the purpose of it? I mean, they do it from the time they wake up till they go to sleep from all ages. And it's that sensorimotor activity. It's the touching, it's the mouth, it's the movement. That is the major component. It does creativity, it helps socialization, it helps with intellectual development, but it's that activity that makes all the other. 3 children playing a board game would be an example of what type of play? And that's called cooperative play. Solitary is alone. Associative, playing together, no goal. And parallel play, you're toddlers. One kid's here, one's here, and they're not sharing. They're just next to each other. The head to tail direction of growth is referred to as from the head, you lift your head up first. And then it goes to walking or attempting walking by 1-year-old. Well, the head is cephalic, right? So cephalocaudal is that answer. Sequence is you lift your head up. and then you turn from abdomen to back to abdomen. Then you creep. That's sequential. What is the single most important factor to consider with communicating with children? And that's their developmental level. Yes, very good. What 2-year-old child pain assessment tool should the nurse use? Kids 2, what do you use? Remember we've talked about numeric, age 8 and higher. We talk about Oucher, it's just one of those scales that we use, but I don't give you ages on that. We give you faces at age 3. Black is nonverbal and up to age 3. Faces start at age 3. They have to see a picture and point to it, okay? And that's 3 years old. Flack is when you look at them and you can figure out what their pain scale is. Nonverbal, and that's up to age 3. And at age 3, faces takes over. At 6 months, an infant's birth weight should do what?
Double.
Absolutely. And there you are. Yes, it doubles. Those are some common questions they ask. The first expected fine motor developmental milestone for an infant begins with what? Remember, F, fingers. Fine motor, fingers. And it's that reflex. Remember, mommy put her finger into the crib and the baby grasps it, and it's a reflex palmer. Then it goes to voluntary. At 8 months old, an infant should be expected to perform which fine motor scales? Again, fingers, what do you think? So they should be able to grasp that rattle, and then they're in that crude pincer grasp. Excellent, very good. The natural physical developmental sequence that most children follow is, and this is all your gross motor skills right there as an infant. What happens first? And they lift their head first and then roll over, front to back to front, up on their knees. They creep, they crawl, they cruise, and then attempting walk by one. Which behavior indicates an infant has developed object permanence? Well, this is something where you have a toy and then it hides, and the infant saw it, but now they can't see it. That infant still knows it's there, so they go looking for it. That's object permanence. Just like the 1-year-old, you put the toys away at night, right? In the morning, they go to the toy box and they pull it out. Object permanence. Even though it's in sight, they still will go look for it. They know it's there somewhere. In general, an infant should triple their birth weight at how many months of age? You know, this is one of those important questions because if they're not gaining weight or gaining too much, there's going to be some sort of thing that we need to do. Yes, at 1 year they should. Performing a head-to-toe assessment on a toddler most important to consider before beginning the examination. Toddlers ages 1 to 3, probably the most difficult. They just don't like us. All we've done is give them shots and measure them and put them on scales and all different things. It's always based on their developmental level. Very good. According to Piaget, toddlers are in the blank developmental stage. Isn't that where they touch it, they feel it, it's in the mouth, they move it? It's all about that experimenting and building on that. First to hearing that rattle, and then it's in the mouth, I like it, and then, oh, I can move it all over. It's called sensorimotor. Very good. Which intervention helps a hospitalized toddler feel a sense of control? You ever take a 1 to 3-year-old kid out on vacation and they're all discombobulated, right? And they don't sleep, they're a little bit cranky. Why? Because they got to be on the same routine. If you put a kid, even in the hospital, try to do the same foods, same nap time, bath time, bedtime. If you do those things, the kid feels better. They know what's expected. That's why vacations are so hard. All children reach developmental milestones at the same age, yes or no? Absolutely not. They're all different. Immunizations for a 4-month-old infant. What action should the nurse take to provide atraumatic care for this infant? Well, first going to do huggies, right? Want to have the parents hold the child. And we're going to give them that pacifier. Absolutely. Very good. Or breastfeeding. It is an option. Which of the following immunizations can be administered to a newborn? And it's hepatitis B. You know, as we go along, I'm going to tell you which immunizations you really need to pay attention to. When you open the book, it's a double paged of all these immunizations. You're like, what do I need to know? And we're going to be going over them. The normal heart rate for an infant is what? It's 140 to 160. What is the preferred site to give an injection to an infant? And if you see the way that this immunization is being given, I would never do it like that. I'd have the mother holding the hands, talking to the child with a pacifier. It's the vastus lataris. The upper calf is the lower leg. No. And deltoid, it's not till later on. The death of an infant under 1 year old with no known cause. What is it called? And that's SIDS. It's sudden infant death syndrome. We're going to talk about more of that next week. The Vietnamese mother of a child avoids eye contact with a nurse. Considering cultural differences, why does she do that? Why isn't she looking at me? And it's respect. That's all it is. Again, that's culture and understanding it. A child from Mexico is hospitalized for a serious illness. And the father says the child's being punished by God. Why? Again, it's a common health belief. You know, children about preschool or up, they believe that if they get sick, it's because they did something wrong, that they're being punished. It's part of the way children think at that age. Which term refers to times in an individual life when he or she is more susceptible to positive or negative influences. Part of your matching is another one of those terms. If you're susceptible, you're sensitive. It's the sensitive period. What is characteristic of the pre-operational stage of cognitive development? Again, this is where you have that child who has a sippy cup on a high chair, throws it on the floor because they know mommy's coming. It's because they've done it already, right? So they probably did it first as a mistake, but now when they want mommy, they throw it. So thinking concretes means they've seen it, done it, touch it, felt it. Okay? Concrete, they know what it is. They can't imagine it. They have to see it. So that sippy cup fell off once. Mommy came over, got it, put it back on. So then they know I throw it on the floor. I know mommy's coming. That's the concrete. And last question. According to Kohlberg, children develop moral reasoning. What is the preschooler's stage of moral development? What do they believe? Their morality. Kohlberg. And again, this is all about good and bad consequences, and that's going to be an action, some sort of consequence for either good or bad. So they are starting to make decisions on their ages. And we're going to go on that more even next week. Let's see how we did today. Number 3, Shadisha, good job. Number 2, Caitlin, good job, Caitlin. Number 1, Kay, good job, guys. Keon and Jen. So did you like the Kahoots at the end of the class as a quick test of what we
Yeah.
sort of learned?
Very much so.
Yes, I did.
Okay. I'm the one who makes them, and what I do is every single quarter I go through and look at exams, and I look at HESIs and what concepts are there, and I try to add more and more questions to them or take some away. I'm trying to give you those concepts that you might see, so they are important for you. Remember, next week we have our first quiz. It is at the beginning of class, so please be on time. Come in on your phones and we'll go from there. Usually I will do the first half hour as the quiz and we'll start class at 3:30 when we're done, okay, to give everybody plenty of time. Again, if you have accommodations, please send me those letters so that we can work up and your quiz can have that extra time on it, okay? Guys, it's been great. Thanks. Anything, let me know. Talk to me. Communicate. That's all I need. Have a great evening. Have a good weekend.
Thank you.
You're welcome.